I am 19 weeks pregnant right now, and I'm a certified nurse midwife, and one of the coolest things about being a pregnant midwife is getting to use my own pregnancy to educate you all on yours. I'm going to show to you and explain to you my anatomy scan so that you can better understand what it is that we're looking for and what it is that you're looking at when you go in to have your own. First off, when you're looking at the screen, the top is always going to be the side closest to the ultrasound transducer, so the outside of the body. I can already tell that my placenta is on the far side of my uterus, away from the transducer, meaning that I have a posterior placenta, which is perfect. I love that. As you can see, my baby's in a funky position with their butt and feet towards the transducer, so that means their butt is facing up towards the sky. Now, there's a few things that we look for in an anatomy scan. There's some measurements that we take, some of which are going to help us determine the size of the baby, and some measurements we just need to know. She's measuring the length of my cervix. The cervix is typically 3 to 4 centimeters long, but anything over 2.5 is considered normal. She's also measuring how far my placenta is away from my cervix. It needs to be at least 2 centimeters away for a vaginal birth. We also want to look where the umbilical cord inserts into the placenta. Ideally, it will insert straight into the middle of the placenta like you can see here. Then we're going to look at the baby, look at their brain, including the ventricles, cerebellum, choroid plexus, septum pellucidum. We're going to look at their heart. We're going to look at all the different chambers as well as the major blood vessels, get a heartbeat. We'll look at the umbilical cord where it connects to the baby's body. Funny thing about this view, oftentimes the umbilical cord is mistaken for the baby's gender. That right there is not the baby's anatomy, but that is. So don't assume your baby's gender until your ultrasonographer, provider, or your NIPT confirms it for you. We'll also look at the baby's spine. Is it aligned? Is there any evidence of spina bifida? We'll look for hands, fingers, toes, organs like the stomach and kidneys. We'll also look at baby's face and palate for any evidence of a cleft. And if you're really lucky, your sonographer might take a 3D picture for you. I hope that's helpful. Let me know what questions you guys have in the comments.